we've never been involved with the Joint Commission out here at SNU, and I must say I'm relieved by that, because we've been very well served by Medicare.
It's okay, though. It's okay, Roy.
Dr. John Steele is the medical director at Guam Memorial Hospital's skilled nursing unit in Barrigada Heights. He is one of many local doctors voicing concern over the hospital spending funds to keep up Joint Commission accreditation. Dr. Steele says the Centers for Medicare and Medicaid Services certification is more important because that's how the hospital receives reimbursement for caring for patients covered under Medicare and Medicaid. GMH is currently at risk of losing its Medicare certification after CMS came to do an investigation at the hospital this past July.
They felt there were so many faults that we weren't meeting. They didn't criticize the Joint Commission, but they said, what you're doing is not sufficient. So they made a number of requests for corrections, and the hospital now is busy meeting those recommendations, and they'll come again in December, CMS, to make sure that the corrections have been made.
Dr. James Stadler of FHP Health Center, however, is of a different mindset than Dr. Steele. Dr. Stadler was serving as the medical director at GMH the day Joint Commission accreditation was announced.
This is how happy we all were after accreditation. I'm not sitting there. I had already left by this time in August of 2010, but I was here for the entire survey. And so I felt part of it and was very, very proud.
GMH has spent $110,424 to keep up JCAHO accreditation, which is the Joint Commission accreditation, since the year 2006. And they've spent more than $515,000 in resources to meet the accreditation needs. But Dr. Stadler says it's worth every penny because it puts patient care at a higher standard than CMS accreditation.
People say, oh, there's too much paperwork, but most of the paperwork actually is fairly easy. The hard part is the important stuff, the making sure the surgeons, write legibly, the doctors, I should say, write legibly, and that informed consent is done, and timeout is done before surgery and so forth. Those are the hard things.